Kajiado Press. Your voice, your stories, your platform.
My name is Sadera Alfred, also known as Dr. Panadol, and I am a regional coordinator for Eezer Initiative Services, a maternal motorcycle ambulance program that has been here for about 10 years now. So Eezer Initiative, as I said earlier, it's a maternal health program, but very specific to transport. Eezer Initiative Services is a motorcycle ambulance program that we develop a kind of an ambulance, as you can see here, to help pregnant mothers to come from home to the clinics and back. So we will explain it in 3 stages. There is what we call 3 delay models, because an ambulance is always a vehicle at the time of an emergency. So when before you reach the emergency, there are things that comes in, and I will call them the 3 delays models as outlined in the WHO models of how to explain an emergency, especially on maternal health. And the first delay model is always on the issue of decision making, when the family or someone to make a decision, or even the client themselves, which is a pregnant mother, to come to the clinic. That is the first delay model. The second one is on the issue of procurement of transport from home or from the place they are to the clinics. The third one is on the issue of availability of the service. The issue of availability of the service: are the hospital available, or are the medics available, are the commodities or the supplies available? So where we come in as Eezer Initiative is on the issue of transport procurement. We want to bring a solution to these mothers, and even just anybody else who needs a cheaper, affordable, and reliable ambulance, especially in the rural. We started as bikers or motorcycle riders on our own adventures in the rural villages around Masai Mara, some other time around Kajiado, and some in Tanzania. We got to a vision of starting a motorcycle program, or how are we going to use our motorcycle riding skills to change health of people, now bringing the convenience to the pregnant mothers. How are we going to make the motorcycle able to carry a pregnant mother comfortably, other than the usual way of carrying a patient behind you? Of course, you understand the challenges, or how it will be very difficult for a pregnant mother, especially the one in labor, to just be behind the rider. I think it will be comfortable to bring them in an ambulance like ours. So actually, the inspiration is due to the affordability, convenience, or availability is even in the rurals, because you find in the rurals there are many motorcycles than cars. So we want to make this motorcycle able to carry these mothers, especially in labor, but in time they cannot really be on the normal bikes. I am a regional coordinator for Kajiado and Narok counties, and in Kajiado County we already have 15 clinics that are supported by our initiative, and they have the motorcycle and the ambulance, as we call it. And for Narok, we already have another 10, and we want to add more, 15, to make 25. In some other countries like Burundi, we have over 50. So talking for the case of Narok and Kajiado, I think we are heading to around 40 motorcycle ambulances in the rurals. This product is very good in the rurals, because when you go there, you will find like the roads are very narrow. Even the drivers themselves, many people will ride a motorcycle than a car. It is very cheap to maintain. The spares are all over. The issue of fuel, of course, you cannot talk. It is 20 times cheaper. Yeah. And even general maintenance, you can get a mechanic for a motorcycle in Bisil, in Kii, Iltilal, Masai Mara, Loita. You can get a mechanic for a motorcycle, but not for a car. I think we've heard so many stories from our riders, these people who are using the motorcycle. And actually, when we started, we were just giving anybody to be a rider or, a person to ride this motorcycle, including our medics. But a challenge came in when these mothers along the way, they need to deliver. And such challenge made us to think further and even going ahead and train female nurses to be riders.
Okay.
To be riders, they are riding the motorcycle themselves so that they can deliver anywhere. So as they get a call to receive these mothers or get these mothers from home to the clinic, they go with everything they need, just like an ambulance.
Okay.
So you can do a delivery along the way. It is better. You can see it has a Macintosh or where you can do later your cleaning. You clean and disinfect the coach. So this is like a delivery coach. The biggest challenge with this one is, of course, sustainability, because we started with international donors, and now we want to look for local donors because it is not sustainable to be looking for, financing outside people who doesn't understand much of your problem, and maybe you yourself, the one who is feeling the problem, is not funding or maybe is not supporting the idea. So the biggest challenge is always on the issue of sustainability, on funding. We have difficulties giving more motorcycles. So we want even county governments or any other partner in health to come in and buy motorcycles, like our product, even to give to more clinics. So that is the biggest challenge, the issue of sustainability and maintaining it, to have more bikes and give to more clinics. Because one thing I know, this is not a product we will ask ourselves whether it is good or not. It is already working, and I think many have seen it in the clinics, because I think for a place like Kajiado South, we already have 5 of them. 5 in Inki, Iltilal, Lolakir, Ogululu, and Lemongo, and Nola City. Those are places that, if you know those places, they are very remote, I will say, and some of them are even very hardly accessible to just normal vehicles, or even communities living around those places cannot afford to have a 4-wheel ambulance. Personally, the dream is to have more of them in the clinics, especially in our rural clinics. And now that many governments are even doing the issues on primary health care, the universal health coverage, where these services will be brought near the people. As they address the issue of maybe structures, personnel, commodities, I would also want them to concentrate on the transport, the ambulance service. So before they get to the extent or to be able to have a 4-wheel ambulance, I will even call them to take our product and use it before they get to have more funds to do the 4-wheel ambulance to maybe these level 3s, which are health centers, and level 4s that are even the rurals. Like, for example, those around Kajiado, like Mashuru, Bisi, and many other that are high volume. A supplementary ambulance like ours can really change a lot. We are having already programs in Kenya that are already ready to receive any support from local donors or even the international donors. One of them is Africa. We have Avia Charitable Trust, which is already a trust that is connected to this one. We have a program called Together to Get Her that is working to promote maternal health in Africa, and more so on the pastoralist communities. So we have our offices in Kitengela, and we are working together with Cape to Cape trailers to make more ambulances and sell to county governments and any health partner. So you can reach us in our office in Kitengela, then we can discuss more, and we push this thing together. Maternal health is a collective thing. We need to do all of us so that we can reach our targets of reducing the maternal mortality and morbidity in Africa. Thank you.
Kajiado Press. Your voice, your stories, your platform.